Hi, this is Dr. Brennan from Brennan Chiropractic in Anvil. I thought today we would share with you one of the really cool options we have for adjusting our patients. Most people know that chiropractors use their hands. They use their hands to find places in the spine where the bones aren't moving correctly. And we use our hands to push or turn or twist to move those bones. If the bones are moving better, there's less pressure on the nerves, and it allows those nerves to send and receive the messages better. So the problem is not everybody likes the what I call old school or old-fashioned adjusting, the kind of hands-on snap, crackle, pop stuff. Some people love it. It's perfectly safe and fine, but the profession needed to have a safer, less invasive, and just as effective tool to help patients who can't tolerate that. Maybe you have spinal arthritis, or maybe you have a condition in your spine that doesn't suit well for the old-fashioned or old-school adjustments. So we've been using an instrument by a company called Sigma for about 15 years now. So many people have seen it, but for those that have not seen it, I just wanted to give you an idea of how it works. In the instrument, there's a sensor. It's a piezoelectric sensor, and that sensor measures how things move. So it's very sensitive. So instead of using our hands to find maybe where the bone needs to be adjusted, what we do is take the instrument and slide down the spine, and at each vertebrae, we take a measurement specifically to each bone, which tells us how those bones are moving. We can then take that information from the computer, and we can find what's the best segment or best location for us to adjust you. And then when we adjust you, the instrument will use a percussive or a vibrational sense. I'm just going to go through and complete this. And I'm going to select a vertebrae. And what we do basically is hold over that bone, and we use a percussive vibration action to move the bone. It's very safe, non-invasive, very comfortable. I've been using it now for almost 15 years. The beauty of this instrument is it's connected to a computer, so it gives us much more specific data to enable us to know exactly how you need to be adjusted. And then one of the other really nice things we can do with this is to use the instrument as well to do muscle work. So we can get onto a muscle maybe that's tight and use the instrument to vibrate and to percuss those trigger points or those tender areas. Again, a very safe, a very comfortable alternative to the old school methods, and one that allows me to not only adjust the spine, but then also to do muscle work. My personal philosophy is that I will do whatever works best for the patients, but it's really nice to have an option like this, which is safer, less invasive, and more comfortable. So I hope that helps you understand that here at our office, we want to find the best way to adjust you, the safest way to adjust you, and certainly the most comfortable way to adjust you. Look forward to talking to you soon.